Hi everyone. We'll wait for minutes because there are lots of people who have expressed the interest to join, and then as soon as we have sufficient people join from the registrations, we are going to start, which is going to be in the next 2 minutes. So I think let's start the webinar while more and more people are joining this conversation. A very good afternoon to all of you. I'm Niranjan Sagoti from Population Council. And on behalf of the Family Planning, Measurement, Learning and Evaluation Consortium, I'm pleased to welcome you to our second webinar. It's in the series of 8 webinars over a period of next 2 months that we'll be doing on moving ahead with 2030, transition from 2020 to 2030 and its measurement plans. Thank you for joining us today for an interactive session to learn about and discuss the journey from the FP2020 to FP2030 and how we in India has adapted and progressed over time. For the people who are not aware of the Family Planning MLE Consortium, it's constituted to provide grounded evidence on efforts to improve family planning in India, with particular reference to Bihar and UP. And the consortium led by the Population Council brings together the technical support units led by Care India in Bihar and the India Health Action Promotion Trust in Uttar Pradesh, the ICRW, and the Center for Gender Equity and Health based in UC San Diego. The consortium is trying to collectively support the family planning program with data evidence. And today is Dr. Jay Chandran. He is currently working as Senior Technical Advisor to the Track 20 India project being implemented by Avanir Health based in USA. This is a global initiative to monitor the progress of FP 2030 goals. It was doing the monitoring of FP 2020 during that period. It was working very closely with the countries, including India, on the progress that the country has been making on family planning. He also supports the family planning division in the ministry and the FPMLE consortium of with a lot of that estimations on where we are heading and what the gaps are and go forward in measurement and planning. And Dr. Jayachandran, if you can come on camera and say hi. So our discussant today is Dr. Sanjay Kumar, who is very well known and working as population dynamics and research specialist at the UNFPA in India. and he has more than 2.5 decades of experience in research on population dynamics, reproductive health, nutrition, and gender. He has published many articles in reputed journals. He has been closely working with various ministries on sustainable development goal indicators and its monitoring, and providing technical inputs to the large-scale data systems such as the National Family Health Survey. So in the next 15 minutes that we have, we'll first hear from Dr. Jayachandran, a presentation for about 20 minutes, followed by the comments from Dr. Sanjay on his perspective of the measurement plans for the Family Planning 2030, and reflection on the presentation that's made by Dr. Jayachandran. We'll also have sufficient time, which is about 20 minutes that we have assigned for answering questions from the audience who joined us today. So we look forward to an interactive session. So I'll request the audience to please keep sharing your questions on the chat or Q&A window. We'll take them up after speakers have shared their views. And I'll be tracking on the questions and then compiling them and grouping them into to ask the presenter or Dr. Sanjay. So with that, let me request Dr. Jayachandran, over to you for your presentation.
Thank you, Dr. Niranjan, for nice introduction. And at the outset, I would like to thank FPMLE Consortium for inviting me to present the findings or the results of this important topic to discuss about it. And it is very interesting how FP2020, that is Family Planning 2020, has moved to FP2030. We can look at it in the next few slides. So over the last decade, that is 2012 to 2020, the FP2020 consortium, which was initiated in 2012 after about 2 decades of ICPD Cairo conference in 1994. In fact, a meeting was convened in London on July 11th, 2012. The meeting was organized by a group of consortium people, that is the DFID and BMGF and UNFPA and USAID. The 4 people have organized this meeting, and this meeting was attended by many people, government officials, state heads, and researchers, and all groups of people who are working in family planning area, and decided to form a group. And the main objective was to rejuvenate the family planning issues around the globe. And at the outset of, after effects of that meeting was the FP2020 consortium was formed, or initiative was formed, and about 69 countries were pledged in that initiative to get the contraceptive, empower the 120 million women and girls to use the contraception and make critical decisions for their health and their future. This was the primary goal of that initiative, and it was a very short period of time, 2012 to 2020, and of 8 years. So this short duration and with an ambitious goal of 120 million to be achieved by 2020 was a turning point in the history of family planning scenario. Especially after ICPD, family planning sector was lying low or under the table. And this initiative, in fact, brought the renewed attention to this sector. And most of the countries started discussing about family planning and assess their progress, set very bolder goals and strengthen their system to monitor and identify the opportunities to be even more ambitious and fulfill their promises to women and girls. While looking back, now in 2023, while looking back, we can see that around 130 countries and partners made commitments and took action to expand the access to family planning around these 69, especially these 69 focus countries, low-income countries. And they expanded the number of modern contraceptive users in 69 low-income countries by 33 million in Asia. This is a geographical breakup. And Central and Western Africa grown by 70% in Eastern and Southern Africa. This has revolutionized, actually this initiative has revolutionized how the family planning data is collected and used, shifting from periodic surveys to robust annual reports. Until then, we were all depending upon the periodic surveys, which used to come once in 5 years or 10 years. And globally, it was very difficult to get the status quo about the family planning. But because of these initiatives, especially the monitoring system has very much strengthened. And now moving to FP2030. So building upon the FP2020 success, FP20, all the partners, countries, all the countries participated, or all the stakeholders strongly believe that this movement to continue further. And it has aligned now with the SDG. That is why it is now named as FP2030. So very grand vision they framed the very grand vision with a vision tagline of working together for a future where women and girls everywhere have the freedom and ability to lead healthy lives, make their own informed decisions about using contraception and having children, and participate as equal in society and its development. This is a very pretty grand vision, and with this, because of this last 2 years pandemic, this has pushed a little bit, and this work is still continuing and getting it done. So you can see how the vision has changed to the how the countries they want to work with, that is expand the narrative about the policy dialogue and drive the data and evidence-based information informed decision making, and increase, diversify, and efficiency use of financing. This is also a very important part of this particular framework, because more and more countries are now depending upon their own resources, finding their own resources. So this becomes the very important aspect. And the other aspect is gender norms, social and gender norms transform, because this was lacking in the FP2020 arena, and the improved system responsiveness to individual rights and needs. So such a grand vision, now FP2030 is started and moving on. Now, if we look at what are all the important changes, what has happened in 2022 versus FP2030 envisioned. In FP2020, it was a 69 focus country that all the focus was on the 69 low-income countries, whereas in the FP2030, all the countries are welcome, depending upon their resources, depending upon their issues, they can join in this movement. So all the countries are welcome here. And the second part, like country support through centralized secretariat, whereas now country support is managed by regional hubs. This is a very important shift now in FP2030. There are 5 regional hubs created. Previously, it was centrally, central secretariat was managing all the activities, which was based out in United Nations Foundation at DC. And data use and tracking towards 100 million additional users. This was the overall goal for the FP2020, whereas that particular goal is removed, whereas updated framework, monitoring individual system, and environment levels are replaced. There is no specific target per se, but just like SDG, it is a last mile approach. one has to go beyond all the conventions and reach all the unreached groups. A marginalized group, all are involved in this one. And in the FP2020 arena, it was knowledge dissemination, whereas in FP2030, it is a knowledge sharing through interconnected regional hubs. These regional hubs are now becoming more powerful, and all the regional hubs will be sharing knowledges each other and connected in each other, so that knowledge dissemination per se, or that will become a knowledge sharing platform. And promoting high impact rights-based practices was one of the key areas for the FP2020, whereas FP2030, it is a global, regional, country level advocacy and accountability. More and more grassroots level approach it has adopted. So broaden the focus, that is expanded value-based partnerships, preserving accountability and functions as a knowledge sharing, that is what we just mentioned, and forging new ties beyond FP community. This is a very key activity which is highly focused. That is beyond FP, we need to find out the, just like HIV or faith-based organizations, and there are whole lots of lists are coming in the next few slides. We can see forging new ties is the new focus area, and promoting women's right and agency and choices. So FP2030 under these guiding principles will work on it, and this is the only global partnership centered solely on family planning. So this singular focus allows all the community to bring together widest possible range of partners across the disciplines and sectors, while situating in family planning at the crossroads of the global health development and gender equality agendas. So these guiding principles are very much relevant in the current context for all the countries, irrespective of their income group. So FP2030 is looking forward to work within these principles. And here there are 8 groups identified as the primary focus groups, which are left behind during the FP2020 arena. The first one is adolescent and youths. Adolescent and youths were, we felt after looking at all the data, we felt that FP2020 left behind this group. So this is one of the focus groups in the FP2030 going forward. Integrating FP and HIV, because of leveraging different sectors activities, now FP will get gainful, much gainful. So that is why this is especially focus in African settings, that HIV and FP integration is a very highly focused area. Civil society engagement, it is continuing because FP2020 largely talked about civil society engagement. That continues to happen in FP2030 as well. And this is postpartum abortion and postpartum FP, which is one of the high impact practices identified by different research agencies. So this is another focus area in the FP2030 going forward. COVID-19 and FP, because of this pandemic, we saw that how such a pandemic of large scale can impact overall health system. So this is another area which is currently in the focus, COVID-19, because COVID-19 still scrolling us on every moment and everyday life. And rights-based FP, because again, family planning, many countries have successfully achieved or largely scored over their goals. So now the focus area is on the rights-based approach. How to family planning can be provided, services can be provided to the people with the right-based approaches. So this is another key focus area. emergency preparedness and responses is the next focus area, because there are several natural calamities and man-made calamities that are happening around the world. So emergency preparedness and their responses is very key, another focus area. And of course, last not the least, faith-based communities to be taken along with us and along with this journey. So that is another key area. And as I mentioned, that 5 regional hubs working together, because previously it was centered around North America, that Washington, D.C. United Nations Foundation was the secretariat. Whereas in the FP2030 scenario, there are 5 regional hubs. Asia and Pacific is situated in Kuala Lumpur, led by IPPF. And Africa got 2 regional hubs, one in Abuja and the other one is Nairobi. Abuja regional hub is hosted by Pop Council, and Nairobi hub is hosted by AMREF Health Africa. And the Latin America hub, yesterday they declared, and it is being given to Save the Children in partnership with Proformia Colombia, an organization in Colombia, which is based out in Panama City. And North America and Europe hub, again, same old secretariat in Washington, D.C., managed by UNF. And we can see how the measurements are deviated from, this is the main topic of this presentation, whole topic. So let us see how FP2020 measurement success, what we are building upon. That is because, see, until FP2020 initiative, all the family planning indicators or key indicators were like in a very haphazard way, largely depending upon the NFHS or DHS surveys in other parts of the world. And the alignment, what FP2020 did was the alignment on a set of key family planning indicators for annual country reporting. There are 17 key indicators created as a reporting under the reporting mechanism, and this is uniformly applied to all the 69 countries across the FP2020 lead. So this was one of the key parameters that got success in the FP2020 measurement. This is sort of an achievement. And in the country-led, so all the 69 country focus countries, it was a country-led approach that reviewing the data, assessing the progress and reporting. Because there was a set of processes which we followed during that FP2020 arena, and that process was well laid out, and how this data, in-country data and in-house, how it can be reviewed, and how it is assessing the progress, and the reporting mechanism was very standardized. And data analysis and estimation methods that help the countries to assess the progress more regularly using all available data, that is surveys, survey statistics, and financing, etc. So whatever the available statistics, that is whether it is a survey, whether it is a service statistics, whether it is a financing activities, anything, all the data analysis was very clearly laid out, followed by that clearly laid out activities, and it was informed to the policymakers and the country level mechanism, which was later reported to the global reporting, and increase the availability of data in different formats for decision makers and advocates. So this has helped a lot for the country mechanism to monitor the progress. And this was again another important thing which we carried out in during FP2020 was forming an expert group to analyze, to review the data, to review the results, and etc. A forum which was continued and advancement of measurement. This was very interesting achievement in the FP2020 activity. So you can see how it was spread out, that FP2020 and FP2030, that new countries have listed, and the old countries, 69 countries, are renewed their focus. And now it is, you can see there are 81 countries now started reporting from 69. So 14 new countries have joined and 2 countries have left. These 2 countries, one is Iraq, and the second one left was South Africa. And there were 14 countries. There are 14 countries joined as a new in the FP2030 consortium. So there are now around 81 countries, and still counting every year, every month, month-on-month basis. And the advancement which was taken in the measurement plan was all women MCPR will be a regular part of the discussion. Whereas previously it was married woman, depending upon the country context. Like India was always reporting married woman MCPR for global reporting as well. But now onwards, it is bifurcated to all women, married woman, and unmarried woman. These are 3 specific groups separately will be reported. And creation of methods and tools to follow, to allow for annual estimate of key FP indicators. That is the, we call it FPET shortly, that is Family Planning Estimation Tool, which is a modeling tool which help us to get all these 17 core indicators by applying the standard formula. And the development of indicators. This was in the next slide. I will show you which are all the new indicators I've created in the FP2030. Standardized methodologies and approaches, which carry forward from the FP2020, which was expanded now. And you can see what is the Track 20 project which is doing, which is part of the FP2020, now FP2030 consortium. And Track 20 is mainly the objective of Track 20 is to measurement, how the measurement field is advanced, and how the global reporting and etc. And meaning the pushing the method and data use to be more effective and locally available for the country-specific activities. So these are the new FP indicators that enabling under the enabling environment. There is no change. All the indicators are standstill. Under the process indicators, there is a source of method by public versus private, which is included as a new indicator. Under the output category, the method information index plus, MII plus. Earlier it was MII, and now MII plus is included. And under the demand for family planning, that is unmet need for family planning, all the specific groups are included. All women, married women, and unmarried women are separately will be reporting, as well as the total modern users, method users. This will be given out by the all women. Earlier it was married women. And under the outcome group, the modern MCP now we call it, all women separately, married women separately, and unmarried women separately. So similarly, demand satisfied also will be given by the marital status. And otherwise, most of the other indicators are stand still same. And these are in one highlight is that a traditional use will be started reporting. If it is greater than or equal to 5% for a specific country, then the traditional contraceptive use will be started reporting. So that is a good move they have taken. And we will be continuing to use the uncertainty bounds. 95% uncertainty bound will be continue to report that one. And what about the India? How India has changed very quickly now moving. So FP2020, India's vision was reaching 48 million additional users in, that was the target benchmark we put forward. Whereas in the new vision document, FP2030, there is no such specific target, whereas which is largely under the framework of universal health coverage. That is, we specifically called as a last mile approach. We want to catch all the, we want to cater the services to all the marginalized groups, all the equitable, affordable, appropriate contraceptive choices with a last mile approach. This is the vision for the India in the under FP2030 situation. And similarly, the commitments also, now overall commitment is more aligned with the SDG goals. So there is no specific what you call numeric targets, whereas it is all very very quality, very gender sensitive, very that sort of commitments are now laid out in the FP2030 plan for India. And what we learned from, or what India has given out to world, the innovations adopted in India in the 2020 scenario was the bottom-up approach, which now the other countries are following up. What do you mean by bottom-up approach? For India specific statistics, we use the state level. First, we estimate the state level parameters, indicators. Then we add it up to get the India figures. Now, interestingly, all the other countries are now adopting this approach, bottom-up approach. Very interesting, that one. Whereas in 2020 scenario itself, we use the subnational estimates, that even MPV and ADP districts, Mission Parivar districts, 144 Mission Parivar districts, and 117 ADP aspirational districts. We estimated the district level estimates. Rich Indian data and its complex scenarios always help the modelers to refine the FPET model, which is the backbone of all these estimation processes. And challenges, there are a few challenges we faced. We still unable to use the service statistics, unlike some of the other African countries. They are more reliant on the service statistics, because service statistics is always guiding for the futuristic survey estimates. So service statistics, the quality of service statistics in India is still lagging, so we are not able to use it. And information about the stock out data is still, we are not able to produce it in our global reporting. And finally, the FP private sector data is not coming into HMIS as anticipated, whereas we are still depending upon the survey data. And finally, there are 2 slides regarding the graphs. I want to fill it up with the graphs. So you can see how we are moving. India is moving away from the permanent method largely, that is 68%, to make it as a more spacing methods. That is the current thinking. And you can see how this is just comparing Indonesia with India, where Indonesia, it is largely spacing methods. And with almost a similar expenditure, Indonesia achieved only 1/5 of India's total users. So this is a learning for India, that when we move away from the sterilization, that is the permanent method, to the spacing methods, we may have to shell out more expenditure for catering the spacing method users. So, sorry. And for on a popular demand, what is going to be this is the last year's our estimate says that okay, nearly we will be achieving some 61% of MCPR by 2030. This is the FPET model estimates we are thinking about. So transition, final conclusion is the transition from FP2020 to FP2030 is continuing and evolving. It is always a evolving process. Still, even as I told you that yesterday only, that Latin America hub was created, and all the recruitment process, everything is going on. And second point, integration partnerships, leveraging the resources are major focus areas. all the integration with the allied sectors like HIV, all the other similar reproductive health, all the sectors are getting into more focus. And all-round sustainability is another key area which is put forward by the FP2030, irrespective of financial, but even the other sustainability background. And focus is more on subnational and key populations and the last mile coverage. And learning by sharing rather than dissemination. That is the key, another focus area. And thank you for listening. And yeah.
Yeah, thanks so much, Dr. Jayachandran. I think it's always pleasure here to hear you speak about this whole evolution from the FP2020 and the way that measurement was done during that period and how the measurement has changed now for the FP2030. There are lots of questions, especially in my mind and also in the chat. But before going to the question and answers, I'd like to invite Dr. Sanjay to give his perspective on what he thinks is the measurement agenda for FP2030 looks like. Over to you, Dr. Sanjay.
Okay, thank you, Dr. Niranjan. And first of all, thanks a lot for inviting me to take up this role and so that I can share my understanding or my comments on the measurement part of FP2030 agenda. And this topic is very close to me, and I have been involved since many years as a member of the expert working group, and we have always been, debating which indicators should be included or not included. So it is good to see a very comprehensive presentation, and then that what are the way forwards and new indicators are added. So these are the very welcome step, and surely it will help improve the measurement of family planning program. Before getting into few specific points on the measurement, I would also like to just briefly touch upon what UNFPA is doing as a part of the family planning program in the country. Probably it will be helpful for the audience to know, and probably you may be knowing about it. That UNFPA is a very important, and we have been a technical partner with the Ministry on the Family Planning Program, and our colleagues contributed towards India's Family Planning 2030 commitments, and also the vision documents are a very good document which has come out by the ministry, which actually gives the whole roadmap of FP 2030. And we continue to be the convener along with USAID of this 2030. So still we do have a lot of at stake, and this measurement part is really going to help take the program and feedback to the program and improve it. So it is very, very important and interlinked aspects. UNFPA is now currently actually supporting the ministry towards its efforts on expansion of basket of choices. So as you all may be knowing that 2 more contraceptives have been included, which is one is the implant and the other one is the injectable DMPA, which is subcutaneous. So what UNFPA is trying to do is to provide the first batch of procurement to the government of India so that the program gets launched. And also we will be providing support to roll out of this particular new contraceptive. And in the past, when the Antra program was started, so we also provided the first batch of commodity Antra to the government. And not only the commodity, but also we supported ministry on their request so that the quality assurance in the rollout of the program. So these are the mainly technical efforts which we provide to the government. Coming on the measurement side, which is more important, I think I would also like to highlight that recently we did, Jayachandran talked about, subnational estimation where MPV districts, aspirational districts. So we recently did an impact assessment of MPV program, which was very positive, and it is in our website. So probably those who are here, if they are interested, can go through with that. But most importantly, for the family planning program, and also when the focus of FP 2030 is on adolescents and young people as one of the focus area, we are actually doing two very important studies, and probably it will really help everyone, and also FP2030. One is being done by our partner PGI in Chandigarh, which is on determinants of reversible contraceptive uptakes. And the second one, which is upcoming, and we are just planning for that and going to the field maybe within a month, which is on assessment of family planning used among adolescent and young couple in Bihar. It is going to be a quantitative and qualitative both, and probably the quantitative analysis might feed into 2020 results, because they take a lot of information upcoming, and they do it for the modeling. So probably Jayachandran can look into that when the results come. Lastly, on some of the very specific point about the changes in the measurement or improvement in the measurement part of that. First of all, I would like to highlight a very welcome step that a few indicators have been added, which is very good. Some indicators like sources of family planning, private or public, whatever, or demand satisfied. And also, I was happy to see that, how do we actually focus on family planning services during humanitarian situations? That's one of the very, very important area and welcome step. So I just congratulate track 20 aspects to look into those. Another point is that probably Jayachandran can help us explain. We earlier used to also track the financial aspects of or the expenditure on family planning. So I didn't find any mention of what was going to happen this time, expenditure on family planning program across the country. So those kind of a thing, I don't know whether some deliberate thinking or we left it out, but where are we on that? Another point Jayachandran talked about, service statistics, HMI's use, the quality of HMI's data. Yes, we know that, but I think we had also discussed a lot on that. And unless we show that how is the quality, how far we are there from the standards, and what are the estimates coming out, probably HMIs will remain like that. I think we also owe the responsibility to improve the quality of HMIs data. So probably, if we can just put more thoughts, maybe some consultation, Pop Council can take lead on that, methodological advancement, whatever the way. So I think there is a way forward to concentrate on that particular area. And one of my last few points is, what I see is that capacity building on the measurement. I know we have experts, demographers from F20, but I think we have many stakeholders working in the field. So how do we actually, build their capacities for local level estimation, monitoring, and providing feedback? So probably that particular aspect, if that can be strengthened from this initiative, that will be really good. And when you have got regional hubs, so probably there is a way forward. And lastly, I would take a pinch of that information with little bit, that what Jayachandran was telling, that for shifting from permanent method to temporary method or spacing method involve expenditure. Yes, it would involve, but I think more than the money, I feel, is the demand for the method mix by the population is more important. If people are coming out, having the new contraceptives, use that spacing method, reversible method, I don't think money should be a problem. So probably with these thoughts, I once again congratulate for a very comprehensive presentation and very good move towards the measurement part. Thank you, and over to you, Niranjan.
Thank you, Dr. Sanjay. It's always a pleasure hearing you. Dr. Jayachandran, would you like to reflect on some of the points that Dr. Sanjay raised? And then I'll straight away go into the questions from the audience.
Yeah, thank you, Dr. Sanjay, for a concise overview of these discussion points. And a couple of points I just want to highlight. One is that financial reporting. Yes, we carry forward that to still it is one of the main indicators that we report, and especially government expenditure, especially for India. because the donor expenditure and etc. is very, very minimal. It's hardly in a decimal point nowadays. So it is a fully government expenditure and still continue to get from the government of India. And we are very thankful to government of India for that matter. Second is the service statistics issue. Yes, we all know, we always discuss this during our expert group meeting, that how service statistics can be used. And there was an interesting analysis we did it as a part of that by looking at the IUCD numbers, what generated from service statistics, and compared with the survey estimates. And we found that compatibility is very, very far off. That we can indirectly estimate the CYP factor, and we found that a CYP factor of 0.3 years, whereas the globally accepted factor is 4 years, 4.4 years, etc. So that is the level of discrepancy we are getting from the. However, this is going forward. This is one of our strong agenda points, that we continue to use the service statistics with all the default or all the what you call problems in back of the mind. At least we get a trend. See, there are two aspects to that. One is level and the other is a trend. We might not be able to match up the MCPR levels, but at least we can show the trend, okay, whether it is going up, whether it is going down. So that sort of activity we can certainly, we will be doing it, and that is what. And finally, that building capacity, yes. Again, to tell you very frankly that we already had IAPS in tie-up. We made a couple of rounds of training with the PhD and other students of IAPS. So, but we continue to do that, and with the other stakeholders as well. That is more important, because students, training to students, they take it as a part of curriculum, whereas in the other stakeholders, they will take it seriously and work towards their as a workable point of view. And finally, that indicator, this thing about the indicator things. You know, Dr. Sanjay, it is there is a group called PME working group, Performance Monitoring and Evidence working group. They are the ultimate sayers about this working. I mean, choosing the right indicators and etc. So they convene once in every year, and they review all the requests from different stakeholders, especially from government. And they look at the different studies. I'll give you best example is MII plus, Method Information Index plus, which is a remarkable study by Pokonsil Abarna Jain, and which now came into as one of the indicators. So, I mean, so they regularly review that and incorporate any new indicator. So, yeah. That's it.
Thanks so much, Dr. Jayachandran. I think we have a whole lot of questions from the audience. And I'll mainly ask, sorry to everyone, I'll only focus on the measurement related questions. That's one of the participants is asking, will India have the flexibility to ask family planning use questions from the unmarried women, mainly in the younger age group? That's 15 to 19. And another problem with the large-scale surveys is linked to that. Another problem with the large-scale surveys is that the sexual behavior is very low. Reporting is very low. Therefore, will this affect the FP estimates? I'll also put another couple of questions, and then you can collectively answer these questions. The other is more about this change in from FP2020 to FP2030, the commitment. And there is a shift in that language from the original 120 million users to now more of a rights-based approach. In the global indicator matrix, we don't see anything that speaks about the reproductive right and the agency that is measured or at least recommended. So the indicators that are that you have shown seems to be very traditional of unmet need, demand satisfied. So how is that, and what's the thinking that is going on? And the third question that I would ask is, which probably you must have also indicated, that is the estimation of the couple protection rate. What is limiting the estimation of couple protection rate from the HMIS, at least those states which have the good quality data?
Okay, some of them are beyond my comprehension, but still I will try to answer it. And you people also, you are also all good to respond to all those things. Yeah. So what about the, it depends upon the surveys. Okay, first two questions are related to surveys, that how sexual behavior is very, very low or unreported among the unmarried, especially young adolescents, how it can be. See, basically the new the framework, indicator framework is for global audience, and we just breaking those indicators into three marital groups: all women, married women, and unmarried women. So whatever the survey generates, survey reports, that is the indicator we reported. We don't play around why it is underreported, why it is not reported. No, it is simple as it is. Just it is just to align with the global reporting mechanism. And within India, we can look at it more specifically. What are all the lacking? What are all lacking? What are all unbiased or biased reporting? Those type of extra things we can look at it specifically to the country context. And regarding the estimation of CPR from contraceptive prevalence rate or couple protection rate from service statistics, yes, we can surely, by using the COIP factors, globally acceptable COIP factors, we can estimate the CPR from service statistics. And but as I reported, or as I mentioned previously, it will give us only the levels. I mean, it will not match with the survey estimates. So levels are different, but at least we can get some sort of trend. And with that trend, even while looking at the other African experiences, other country experiences, they're all picking the trend very nicely, because most of the African countries are largely depending upon the big surveys, and which comes in once in 5 years, 6 years, 7 years, and etc. So they tend to use the service statistics and pick up the trend very nicely. So that's my answer. Then regarding the FP2020 measurement plan to FP2030 measurement plans with the gender specific, overall that quality, those sort of things, yes, those specific points are lacking in the FP2030 measurements. However, again, this PME group, working group, that every year they evaluate the plan and go back to the framework and see which are all lacking and how it can be modified. So there is always a possibility to fit in any new methods measurement is coming, and which is available in the peer-reviewed journals. If those things are their set of criteria okayed or classified, then they surely built in that, because that freedom is there, that flexibility is still it is there. So it is sort of a work in progress still, and it is evolving. every time. Okay, because of this last 2 years pandemic, which has pushed actually all the activities pushed now. Yeah, I hope answered it. Yeah.
No, that's great. So I think it's going to be a big challenge given that
Yeah.
how the global indicator framework and which is vis-a-vis the FP2030 vision of India, which is very specific and in a way a little bit more progressive than many other countries in the African region or the other countries.
Yeah.
So from that perspective, it's going to be a big challenge, and some adaptation is required, or at least the India specific measurement plan is necessary. Because one of the questions that also links is that, how the private sector data can get into the estimation. Besides the in the measurement plan and even HMIS is a getting the private sector
Government
data
data,
to the HMIS itself is a big challenge, and that requires a lot of effort.
Yeah.
But otherwise, in how this private sector indicator is going to be tracked in the overall monitoring plan for the FP2030 is going to be key. The other question that someone has asked is is there any example of the national composite index on family planning, whether it was done for India or for any other country in the South Asia? So do you know any of that, that kind of an information?
So as a part of our monitoring plan, we have NCIFP. That is every year Track 20 is a separate group. They send out selected members a questionnaire, and that questionnaire carries sort of a wide range of topics like environment, how policy environment, how data environment in the country, how the quality per se, quality of family planning services, etc. All these 5-6 larger buckets covered in that, and they made up is a composite index. And that composite index is a part of that global reporting every year. So India is faring roughly, that index is vary from 0 to 100. 100 is the maximum, and 0 with the low score. And India is faring, if I believe, last one was 50-52 range. It was, so it is in the middle. So this questionnaire was sent out to a list of different group of people, like academicians, government officers, and researchers, all stakeholders involved in that. Roughly 25 to 30 people will be selected and answer those questions, and made up that point. And if you refer that global report, you will get that NCIFP score. Yeah. Okay,
that's great. So I think we are at time, and one last question, and that's from the moderator, and it's me.
Yep.
So what's your perspective on the unmet need for contraception or the demand satisfied by modern method? How satisfied are you with those indicators in the Indian context? If you were to reimagine those indicators from the reproductive choice perspective, how would you redefine it? Or as a demographer, you would say, oh, no, this is fine. So wanted to get your perspective.
Absolutely. There is a good scope to refine it. Even we can infuse, say for example, the current unmet need for modern contraception. That is what it is being reported. Whereas traditional method is like in the denominator, which is coming up. But the growing evidence is saying that, okay, traditional method also can be a method choice. Why to put it as a bad idea? So yes, of course, there is a, and you also very well known that how unmet need is getting calculated.
Derived.
There are about 23, 24 questions are involved in that, and it is very, very cumbersome activity. And of course, there is a scope for even unmet need can be refined by looking at all those quality indicators. That would be a better idea rather than specific aminoric, this, that, all those type of things. I think that is
the
my
relative importance of those issues are diminishing.
And currently, which is lacking, which is not capturing. Yeah,
yes.
Which is not capturing. Yeah. Okay.
Great. So with that, we come to an end of this webinar, and on behalf of the Family Planning MLE Consortium, I'd like to thank both Dr. Jayachandran and Dr. Sanjay for sparing time and giving your perspective on the measurement from FP2020 to FP2030 and what may be the way forward for Indian family planning program. Thanks again, and we'll continue to have these conversations going forward. And hopefully we'll have a better monitoring plan for the country, and we'll all be contributing to that side. Thanks so much.
And thank you all. Thank you all those who participated.
And thanks to all those who participated.
Yes.
Thank you. Bye-bye.
Bye-bye.